My name is Monique Blough, and I'm a Director of Strategy and Design at the Social Impact Lab. The Social Impact Lab is a partnership between J5, which is an innovation design firm here in Calgary, and the United Way of Calgary. Data shows us that 70% of mental health concerns begin in childhood for adults, and only 20% of kids have the help-seeking behavior and can find the support they need. We started to identify a gap in how children were being supported and being able to access services. Because if we think about it, $750 million is spent on intervention. And so there are so many great agencies out there doing that work with children and youth. So for us, it was extremely critical to partner with those individuals and those agencies that are doing that great work, but to learn where we could collaborate to fill that gap that existed on the prevention side. A natural support is an individual that has the opportunity to develop an organic relationship with a child. So it's really any of us that have a child in our networks. It can be a parent, a teacher, a coach, a friend. So a natural support is not someone that's formally trained in how to deal with mental health concerns. Rather, they are everyday people, potentially, that have the opportunity to deal with a child or a youth and may notice that there's something that they can support that child with. We developed an online simulation that gives anyone that's interested in looking to better understand how to support a child or youth to learn what those skills look like. So things like we have 3 roles that you can choose from: parent, teacher, or friend. And then once you've chosen that role, you also get to choose one of the mental health concerns that you can learn to support. And the 3 that we chose were based on research that are the most commonly ones exhibited by children or youth, which is anxiety, sadness, and self-harm. And what we take you through is a Q&A, a simulated Q&A that is almost a choose-your-own-adventure approach, meaning every response you give gives you a different question. And at the end, what we do is provide you with an outcome of the competencies that are well-rounded in you and those that might need improvement. So the simulation takes about 15 minutes. It really depends on how long you take to digest every question and response. Mm-hmm. And what we suggest and encourage anyone going through the simulation is to be as honest as possible. So often honesty comes with that first reaction. It's the gut instinct of what I would say. And sometimes what we think we would say we know isn't the right answer, but that's the best approach. And so after that 15 minutes, you have a much better understanding of the skills that you can practice in order to be able to help that child or youth that's experiencing one of those 3 areas that we're currently focused on. From all the individuals that have completed the simulation, there's a survey at the end, and from those that responded to the survey, 87% of them has said that they feel better prepared to support a youth that's experiencing mental health concerns.